Earlier today, President Biden visited the Kennedy Presidential Library in Boston, where he invoked the very same language that Kennedy once used to declare the U.S. would send a man to the moon. But this time, the moonshot involves beating cancer. I want to bring in Dr. Zeke Emanuel, an oncologist and professor at UPenn, who was also a health advisor to former President Obama. Dr. Emanuel, thank you so much for joining us. Cancer is, of course, the second leading cause of death among Americans. We did land on the moon, but give us a reality check. Can the Biden administration help us beat cancer?
We are definitely decreasing the number of people who are dying from cancer. We have been doing that, the rate of people dying from cancer, and we've been doing that for a number of years, 25 years. So we can improve upon that. And there are really three things we need to do. One is to change our lifestyle and the chemicals that we intersect with, so we decrease the number of people developing cancers, decrease smoking, for example. Second is detect it early when it's small and curable by surgery or radiation. And third is develop better treatment so people who have cancer.
And so you do sound pretty optimistic. When President Biden took office, he said that he wanted to reduce the death rate from cancer by 50% in 25 years. The White House says that new blood testing will be key. How has that science evolved?
Well, that, again, that's like trying to detect it when it's small so it can be cured in the first stroke by surgery, radiation, or other things. We have new genetic tests that are being pioneered. We'll see if they make a difference. Detecting small cancers.
Former President Obama first asked President Biden, who was then vice president at the time, to lead this effort during his State of the Union address back in 2016. What's been accomplished since then?
I think cancer more or less has gone on as it would, largely because the Democrats didn't hold the White House. This wasn't a focus of the Trump administration, as you might understand. But now, under President Biden, it's gotten renewed interest. And I would say one other thing that President Biden has injected into this effort is a real focus on equity. We know that white, well-off, high-income individuals living in urban areas do a lot better in terms of cancer detection and cancer treatment. We've got to make sure that same high level of care is available to everyone in America, whether you're in a rural area, you're African-American or Hispanic, Indian, and whether you don't have a lot of money or you have Medicaid or, God forbid, you're uninsured.
And this issue is certainly personal to President Biden. After all, he did lose his son, Beau, to brain cancer back in 2015. It's also a personal issue pretty much to every American family. We all know someone who has been diagnosed or potentially passed. What can Americans do in their own lives to help in the effort? Obviously, you said lifestyle choices like smoking, for example, but are you able to give us some suggestion of how we can go one or two steps forward from that?
Yes, I think the first thing is lead a healthy life. Change your diet to eat more of what's called this Mediterranean diet. Exercise and avoid smoking, alcohol, things associated with cancer. Also, go for the proven cancer screening tests. If you're a woman, get and of the right age, get mammograms. If you're a woman and younger, make sure you get a pap smear so you don't develop cervical cancer. Get your kids, your children to have the HPV vaccine that prevents cervical cancer. If you're anyone over 50, get your colonoscopies. All of these tests are very helpful.
COVID-19 infections and fatalities are falling, but experts suggest that we may have lost ground in the fight against cancer as Americans have missed some of those routine screenings and doctor's appointments that you just talked about. How significant is that of an issue and concern in the fight against cancer?
The short answer is we're not 100% sure yet, because if missing a screening, the consequence of developing cancer won't show up for years. So we don't fully know. On the other hand, we have developed these guidelines for how often to have your cancer screening tests, like colonoscopies every 10 years. So it's important to keep to the schedule.
Dr. Zeke Emanuel, we thank you so much for your time and insight. Really appreciate it.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.